For me, it's a simple story. My mom and my dad are nurses, and I grew up in a hospital, and I liked the profession. So when I finished high school, I wanted to become a doctor. There are 7 endocrinologists in Ethiopia, and I am one of them. The number of people living with diabetes in Ethiopia is close to 3 million, and that makes it the first country in the sub-Saharan Africa in the number of people living with diabetes. For many years, our healthcare system is designed to respond to infectious disease. Infectious disease is one contact, so you have malaria, you get treated, and you go home. Our system is not organized to care for chronic illnesses. Diabetes is a self-managed disease. So if you have an educated patient, actually the best doctor for diabetes is the patient himself. In general, we have less literate society, so it's very difficult to educate people about diabetes or even other health problems.
መጀመሪያ ያለኝ እውቀት ምንም ለየው ነገር ሁሉ ነገር አለቀባትም አልበላም ነበር። ግን ጥቁር አንበሳ ከገባሁ በኋላ ሁሉም ትምህርት ስለወሰድ ቅባቱንም ዘይቱንም ለየው። ግን ቢይዘውም ትንሽ አንዳንዴ ይጎላል። አንዳንዴ ስለሚጎል ሲርበኝ ያገኘሁት ስበላ ያመኛል። ዛሬ በልቼ ካመመኝ ተዋለሁ።
If you have diabetes in the rural setting, then it becomes more complicated in terms of getting access to health care, affording treatment or follow-up for the patient from a rural setting. If they are referred for consultation with an endocrinologist, they have to travel from their home all the way to ADDIS, and some of our patients may travel 2 days by bus. Some from the rural area may walk on foot until they get a bus to come to Addis Ababa.
አማጣጤ ለዚህ ለስኳር ህክምና ልታከም መጣሁ። የመጣሁበት በትራንስፖርት ነው። 300 ኪሎ ሜትር ነው የምንመጣው። እዚሁ ደግሞ አልጋ ይዘን 4 ቀን 5 ቀን አድረን ነው እዚህ የምንታከመው። በዚህ ላይ ደግሞ ወደ ጥቁር አንበሳ መጥተህ እዚሁ ጋር ችግረኛ አለ፣ አልጋ ይዞ ማደር ማይችል አለ፣ ምን አለ እየተሰቃየን ያለ። ዶክተሮች የሰለጠኑ ዶክተሮች ቢኖሩና በየክልሉ ቢበተኑልን እኛ እርዳታ ነበረ። ግን የተበተኑ የሉም፣ እየተሰቃየን ያለን።
This system, when you have chronic diseases, you need a working referral system, we say, where patients know where to go. When they have diabetes, where do you go? Nationally, we need policy, we need more priority for non-communicable disease, and then we have to train more nurses and doctors for treating or caring for people with diabetes. After I finished medical school, I stayed in Ethiopia because I hoped that I could contribute to the change that we need to improve the healthcare system in Ethiopia. And as a doctor or as a highly trained person, I wanted to be part of that change.